A co-occurring disorder is a disorder where you have two separate diagnoses. One diagnosis would include a mental health diagnosis, which are things such as schizophrenia, bipolar, depression, and anxiety. A substance use disorder is also a part of a co-occurring disorder, and those include things such as a cocaine use disorder, heroin use disorder, and alcohol use disorder. What happens with these disorders a lot of times is that one will make other symptoms of the other disorder worse. So it's very difficult for individuals with a co-occurring disorder to be successful in the community and achieve recovery. A lot of people have both a substance use and mental health disorder. In fact, research has shown that 7.9 million adults in the United States suffer from a co-occurring disorder. What makes this so difficult is that one disorder could actually feed into or affect another disorder. Thus, it makes it very, very hard for these individuals to find recovery and be successful, even though it's not impossible. A lot of times we see individuals when they first come into treatment that have a lot of issues in their daily life. We often see people who are homeless, living in severe poverty. They may be hungry. They are limited to their community resources, so they don't have medical insurance, so they're not seeing doctors, they're not getting treatment, and actually are staying stuck in this very, very difficult position because of the symptoms of their mental illness and their substance abuse. So treatment is focused on helping them to fulfill those needs so then they can make progress into a life of recovery. Historically, in the community, substance abuse and mental health treatment was segregated. So an individual who had mental health disorders would go to a mental health clinic and receive treatment there. And an individual who had substance abuse treatment would go to a substance abuse agency and receive that treatment there. What we do now, because research has shown that it's so important and so advantageous to people, is to integrate those treatments. We call this integrated dual disorder treatment, or IDDT. What this does is allows the person to come to treatment where they're receiving all of that treatment under one roof with the same clinicians and intensive case management services to help them meet their basic needs. We then are able to help the person to forward progress through the stages of change, which will help them to meet their needs and fully actualize their desire to recover. If you or someone you know needs help with a co-occurring disorder, my name is Tina Goynes, and you can contact Meridian HealthCare at 330-746-6452.